Hey, it's Jessica DaMassa with WTF Health. I'm here at Giant Health, and joining me right now, I have Billie Quinlan. She is the co-founder and CEO of Lika, which is an app that is launching soon, but it is a sexual self-care platform specifically for women to enjoy sex more. So are women not enjoying sex right now, Billie? What's going on?
There is a significant pleasure gap, yeah. So men are twice as likely to have an orgasm than women, and women are twice as likely to say that they haven't had any pleasurable sex in the last year at all. They often cite discomfort and pain and anxiety in their sexual experiences. So yes, women are having pleasurable sex, but a lot of us don't, and there's a lot of times within our lifetime that we struggle to find pleasure in those experiences, yeah.
I love this. We've been seeing, I think, a rise of SexTech this year and a rise of femtech this year, and so you're at an intersection of both. So tell me, I guess, about your experience as a startup in this space, because it's a unique space to be in. Are people kind of turned off by the taboo of this, or are they like, no, finally, solution for this?
Yeah, I think we have come at such an amazing time because people are ready for it, and through user testing, to speaking to our investors, to approaching experts in the space. Actually, when we pitch our idea and we offer the solution, they're so excited by it and they're willing to give information. They want to be interviewed. They really want to become part of the community. So it's really exciting. It is an interesting space. I think I can basically name all the SexTech, femtech founders on one hand, which is crazy when you're coming into this. But everyone's super supportive, and I think it's just such an interesting time for people wanting to break into this industry and provide solutions for women. So yeah, we found it incredibly positive and supportive so far.
Yeah, I mean, it is interesting, I think, like, especially on sexual health, because it is kind of something that becomes an issue or sometimes symptomatic of something else that's going on, if it's like a mental health issue or things like that. So, I mean, talk to me a little bit about how this becomes more of a healthcare issue rather than even just like, I mean, it is an issue if you're not enjoying sex, right? Because it's a natural thing you're supposed to be doing, but it's like, how does this become a healthcare issue?
Yeah, it's really interesting because sex often gets reduced to the physical act of sex, and especially in our patriarchal society, we think about sex as penetrative sex. And actually, sex is so much larger than that. It's our sexuality, it's who we are, it's how we move through the world, it's how we interact, it's how we are engaging now, it's how you think about yourself as an individual. And when you're having anxiety around that, when you're lacking the information to understand the kind of core components in your sexuality beyond just the physical act of sex, that influences your confidence, your self-esteem, your sense of self. So it's so much more than just what's happening between the sheets. It's the conversation that you have with yourself and how you perceive yourself. So Lika is focusing, yes, on how do we have more pleasurable experiences, but actually it's about investigating what's happening mentally and emotionally rather than what's happening physically.
So how are you guys tackling this? I mean, it's like, describe to me, I guess, what you're going to be throwing out into the marketplace to help women have better sex.
Yeah, so Leika is an app, and we'll be launching in February. And what we're creating is a space for women to really explore and discover themselves. And that kind of goes across the whole spectrum of their sexuality. So it's not limited to, as I said, just the physical experience. It's much more in tuning with how they feel. So we're providing phenomenal content that has been rubber stamped by psychosexual therapists, sex educators, somatic body workers, and we're really trying to bridge the gap between sort of ancient historical Eastern practices and then Western practices that we have today, recognizing that people have been using these practices of self-care for so long, but we should be using them, incorporating them in a more Western society as well.
Can you give us an example?
Tantra, for one, yeah. And the word tantra immediately puts a lot of people off. And
I think of Sting. Always.
Sting, yeah.
I'm not going to lie.
And there are some a lot of the work that is done in that space is super interesting, but it's not mainstream at all and would not be accepted by a mainstream audience. But there are some really incredible practices that you can do by yourself or with a partner to become much more mindful of yourself, much more aware of your movement through space, overcoming conflict, and some of those practices need to be introduced in the way that we integrate with each other and with ourselves today. So that's kind of what we're trying to bridge with Lika as well. So phenomenal content that takes you on a journey of discovery, bridged with these practices that helps you learn by doing, because sex is like when we think about sex education, it's the only space that we don't learn by doing.
Oh my gosh, it's so true.
Yeah, right. You ride a bike by learning and getting on the bike and pushing off. And with sex, you sit in a static room and get talked at by an educator who's very uncomfortable talking about it most of the time. And then you're thrown into this experience and there's no one to really support you through that. So by having these practical exercises, we're basically encouraging you and giving you permission to explore in that kind of practical way. And then we have a community element because women have just been saying to us, we really want other women, yeah? And we want to hear the stories, we want to hear the mess of it, we want to hear the comedy of it, we also just want women who get us and a safe space to talk about it. So yeah, content, practices, and then community.
I'm curious, are you guys going to be collecting data on what the conversation is about? And I guess, are you piloting right now?
Yeah, we're in prototyping mode at the moment.
Okay, so what kind of things are people curious about? I'm always curious to know like what the early data set starts to show. Are you surprised by kind of some of the things that are being clicked on or some of the conversations that are starting to happen in the community space? Give us some insight into what's the scoop? What's the gossip from what you're hearing?
Inside scoop.
Yeah, I want the inside scoop.
Well, first of all, I just want to say, like, from the start, data is super important to us, and we take privacy incredibly seriously. Like, women are trusting us with very intimate details, and so their confidentiality is our absolute priority, and the way that we store their data and anonymize it is like our number one priority. Yeah. So, but the things that keep coming up for us is, and this is the reason Lika came about, was a lack of knowledge, like significant lack of knowledge.
Like about what? Give me like an example.
So many women can't even tell you what the clitoris actually looks like.
Oh yeah, okay.
And it's like, it's got 8,000 nerve endings. It's the only organ in our body dedicated completely to pleasure. Yet most women still think it's like this little stubby bit that comes out there. It is. It's got arms, exactly. So there's a real lack of understanding around their actual anatomy and then how they can get pleasure from that. And then communication. So how do you actually have a conversation and express your needs and desires? So those are kind of two main pain points. But what has been really interesting is the appetite to explore desires and fantasies. So having the permission to say your fantasies are totally normal and your imagination getting carried away like that is healthy, and here is a space for you to actually dive into that and explore that so that you can take some of that information and use it in your actual real relationships.
Very cool. Yeah. This is so exciting. I'm excited for you for your launch. I mean, this is such a great year too, I think, for femtech and women's tech, like we had talked about. Billie, good luck with the launch. I'm Jessica DaMassa with WTF Health here at Giant Health. Thanks so much for joining us for this sexy conversation.